We've been making every possible preparation for that, and this country is very, very well prepared.
The confidence back when the global storm was still only on the nation's horizon.
On PPE, we are prepared and we have the stocks of PPE.
The then Health Secretary definitive.
I've said many times that I am determined to get people the PPE that they need.
And then the reality of a global race for personal protective equipment. The first peak of the pandemic, and as intensive care units swelled with COVID patients, PPE stocks dwindled, and staff in some cases made do with whatever they could fashion themselves. 16 months on, and today in 2 reports, MPs of the Public Affairs Committee appraise the government's response. The reports paint a picture of panicked procurement with results that still linger, saying, "We remain concerned that despite spending over £10 billion on supplies, the PPE stockpile is not fit for purpose." As of mid-May this year, 32 billion items of PPE were ordered by the Department of Health. Of that, the report says potential waste levels are unacceptably high, with 2.1 billion items unsuitable for being used in medical settings, equating to over £2 billion of taxpayers' money. Yet in June this year, this is what then Health Secretary Matt Hancock had to say.
Thankfully, because my team did such an excellent job, we never had a national shortage of PPE.
Today's reports also say the government hasn't yet got plans for repurposing excess PPE that eventually arrived, and that as of May, 10,000 shipping containers of it were still to be unpacked.
Initially, we were criticised for not having enough. Now we're being criticised for having too much. Look, we've got a lot of PPE out there. We need to be prepared because we're not quite sure what this virus is going to do. We've seen the development of the virus evolve, new variants coming along. So to be honest with you, from my point of view, I'd rather be safe than sorry on PPE.
The Department of Health say there are robust processes in place to ensure government spending always provides value for money, and they've worked tirelessly to source PPE. PPE, of course, which may yet still be needed.
Well, earlier I talked to the Labour MP, Dame Meg Hillier, who chairs the Public Accounts Committee, and I started by asking her what was the most shocking example of waste she came across in the report.
We were very shocked to discover that there are still 10,000 containers of PPE on port sides in warehouses, and some of it still offshore, waiting to come to Britain. And we're really concerned that that's properly logged and logistically sorted so that it's not wasted, because as well as being vital PPE, it's taxpayers' money sitting in those containers.
But it is a bit rich, isn't it, that there was a massive outcry when there was a shortage of PPE, and now you're having a go at the government for there being an oversupply. I mean, you can see why Kit Malthouse has an issue with that.
Okay, we all acknowledge at the beginning it was very challenging and lots of money was spent, not just in the UK, but we're concerned about what the evaluation of this is. And already, we know the government, the Department of Health has not fully analysed what's in what container, what's necessary. We know some of it's not medical grade, so that needs to be reallocated somehow. And so all of these issues are absolutely vital because it is taxpayers' money that's spent on this. It's absolutely right that we should have a stockpile. The government wants to have a 4-month stockpile, but we've got to make sure it doesn't get out of date while it's waiting. So our job as the Public Accounts Committee is to make sure that there's a proper, robust process so that this money and this PPE sitting on the quayside isn't wasted. So we both have legitimate positions, but I would say to Kit Malthouse and the government, make sure now that this is properly used and not wasted.
You want the public inquiry to start sooner rather than later, but we're still in the middle of the pandemic. Surely you'd be the first to criticise the government if they're distracted from that very important task right now.
It's really important that at an early stage we capture information. And fair enough, maybe some of the witness sessions may be delayed if people are in the middle of dealing with issues. We even were sensitive to that, of course, when the vaccine programme was being rolled out. But a delay of a few weeks or a few months is one thing, but putting off starting it till spring next year is a very late start. And there's crucially, and why we feel this, is there's lessons that can be learned and need to be learned as we go. And we can't wait for a long, big inquiry. It will take years. We need to be moving fast and now.